Hi, this is Cindy Rubin. I am a breastfeeding and fourth trimester doc in the Chicagoland area. And I wanted to talk about the Haakaa today. I don't have one on me at the moment, but it is essentially a pump. It's got a bulb on one hand and kind of a flange style thing on the other. And the flange goes on your breast, and you can squeeze the bulb before you apply it to the breast, and then release that, and it suctions to you and very gently can milk. And just because of its shape, it can be used without that suction and just kind of sit there and collect dripping milk, like when you're nursing on the other side. But the Haakaa has become something that is given to everybody as a gift in their baby shower. And it is something that people recommend using a lot. And I just want people to be wary. It can be helpful, especially just for collecting drops and not using the suction. But when you use the suction, it's acting like a pump. And so we have to be careful not to over pump and lead ourselves into a overproduction state. Also, babies sometimes do a little bit better, especially in the beginning. They do better when the flow is a little bit faster. So you definitely don't want to nurse a baby on one side while you have the Haakaa on the other side, and then switch your baby over to the Haakaa side and do the Haakaa on the other side. Because by the time your baby's on the second side, that Haakaa has already done its job. And whether there's still some milk there or not, you're not getting that initial letdown and that faster flow that may encourage the baby to want to do more on that side. So that's one negative. The other negative is that then on both sides, you're emptying more than your baby necessarily needed to eat. Now, there are some situations where it can be helpful. So putting the Haakaa on the first side, nursing your baby, moving your baby to the second side, and then having the Haakaa on what was the first side. This can be helpful when you have low production. You're trying to build it up, or your baby is not transferring milk great, so you need to empty more. Your baby's going to need more by bottle after they nurse, and so that way you don't have to hook yourself up to the pump. You may be able to just get enough out with that Haakaa and then give your baby that milk by bottle and not have to hook yourself up to the pump. But you still want to be careful not to over pump depending on where your production is, or over Haakaa. So just be wary. There are a lot of things out there that are supposed to be helpful tools, but they can be overused, misused, and actually cause a lot of problems, because overproduction, while it may sound good in theory, it can lead to a lot of problems. Be careful, and if you're getting into trouble with any of these things, or you don't know how or if you should use them, reach out to a breastfeeding medicine specialist today so that they can help you.